For most of human history, doctors have played a reactive game. A patient walks in sick. The doctor investigates, diagnoses, and treats. The disease already had years of a head start. Artificial intelligence is rewriting that equation entirely. A transformer-based model called Delphi 2M, developed by researchers and trained on data from over 400,000 participants in the UK Biobank, can now forecast a person's risk of developing more than 1,000 diseases, up to 2 decades before those diseases actually appear. It does not need blood tests or expensive imaging. It reads sex, age, BMI, lifestyle factors like smoking and alcohol use, and a person's medical history coded in standard diagnostic language. From that, it builds a probabilistic map of someone's health future. The model was then validated on an entirely separate population, nearly 9 million individuals from the Danish National Patient Registry, a different country with a different healthcare system, and its predictive power held. That kind of cross-border, cross-system generalization is rare. It suggests the model has genuinely learned something about how human disease actually unfolds, not just the quirks of one dataset. Delphi 2M is particularly strong at predicting conditions that follow recognizable biological progressions, dementia, heart attacks, and sepsis among them. Conditions like viral infections or rare genetic disorders are harder to forecast, which makes biological sense. But for the chronic conditions that quietly kill the most people, cardiovascular disease, metabolic disorders, kidney failure, the model performs at a level comparable to, and sometimes exceeding, the specialized risk tools doctors currently use. Think about what that means for someone like Celine Dion.
The reason why we sold the house. We're not going to be there. We're going to be spending more time in Las Vegas.
Who was diagnosed with stiff person syndrome, a rare neurological condition, only after years of unexplained symptoms. Or Selena Gomez, who lived with lupus for years before it progressed to kidney failure, requiring a transplant.
Video or just making people feel seen, letting people know they're not alone.
These are not obscure cases. They are examples of a healthcare system that catches disease late, when intervention is harder and outcomes are worse. An AI capable of flagging those risks years earlier changes the entire arc of what follows. How the machine actually thinks, the architecture powering Delphi 2M will be familiar to anyone who has interacted with modern AI chatbots. It is built on the same transformer technology that underpins large language models like ChatGPT. But instead of being trained on words and sentences, Delphi 2M was trained on diagnostic codes. The standardized medical labels that represent every hospital visit, every diagnosis, every recorded health event across a patient's lifetime. In language models, the system learns that certain words follow certain other words, building a probabilistic understanding of how language flows. In Delphi 2M, the system learns that certain diagnoses follow certain other diagnoses. It maps the invisible grammar of disease progression, understanding, for instance, that diabetes and vision loss tend to cluster together in time, that specific cardiac events often precede certain forms of dementia, that patterns invisible to a human reviewer reading a single patient file become obvious when you have seen them play out across hundreds of thousands of lives. The research team at Roche has developed a similar platform called DTGPT, described in 2025, which uses de-identified electronic health records to predict how specific physiological parameters change in patients with lung cancer and Alzheimer's disease over weeks, months, and years. AstraZeneca has built machine learning models that can detect the presence of certain diseases before a patient is aware of any symptoms. Stanford Medicine's MoSK model combines microscopic tissue images with clinical notes to predict cancer survival outcomes across 16 major cancer types. This is not one breakthrough. This is a wave. The underlying principle across all of these tools is the same: human disease leaves traces, patterns, sequences. It does not arrive suddenly, it builds. And in that building across enough records and enough patients, artificial intelligence finds the signal that human eyes miss. There is something in this that resembles the way a weather forecaster works. No meteorologist claims to know with certainty what next Tuesday will look like. But by reading atmospheric pressure, humidity, wind patterns, and temperature gradients, they give you a probability, 70% chance of rain, that is useful enough to shape behavior. Delphi 2M's short-term disease forecasts are stronger than its long-term ones by the same logic. Cancers, which can be triggered by random mutations, are harder to predict across 20 years. Heart disease, which builds through decades of cumulative biological wear, is much more readable. Researchers are also exploring what happens when you give these models more. Feed them genetic data, add blood test results, layer in imaging. Every additional data stream sharpens the signal. The goal is not just a forecast. It is a living, updating picture of an individual's health trajectory, one that adjusts as new information comes in. What this changes, and what it does not, early detection is not the same as prevention. A forecast is not a cure. That distinction matters enormously, and the researchers behind these tools are careful about it. Knowing that someone faces elevated risk for Alzheimer's disease in 15 years is valuable only if that knowledge can motivate action, lifestyle changes, earlier monitoring, clinical trial enrollment, preventive intervention. For some diseases, those options exist and work. For others, they remain limited. A prediction without a pathway is just anxiety with a timestamp. There are also harder questions about who gets access to these tools. The UK biobank population from which Delphi 2M primarily learned is largely white and European. Researchers have been explicit about the uncertainty around how well the model performs for people from significantly different genetic and demographic backgrounds. Medical AI trained on narrow populations has repeatedly demonstrated that it can replicate and even amplify existing health disparities. That is not a reason to abandon the technology. It is a reason to invest heavily in making training data more diverse and representative. Privacy is the other live wire. Electronic health records contain some of the most intimate information a person generates across a lifetime. Using that data to train predictive models, even with anonymization, requires trust, regulation, and transparency that healthcare systems around the world are still working to establish. The same data that could give someone a 20-year disease forecast could, in the wrong hands, determine their insurance premiums or their employment eligibility. There is a version of this future that is genuinely extraordinary. A world where doctors spend less time diagnosing disease that has already taken hold and more time preventing disease that has not yet arrived. Where the gap between a biological process beginning and a clinical intervention happening shrinks from years to months or weeks. Where someone like Selena Gomez's doctors would have had a reason to look at her kidneys long before failure made looking unavoidable. That world is being built right now. From the raw material of human health data and the pattern, recognizing power of machines that never sleep and never stop learning, the forecast is becoming readable. Whether medicine acts on what it reads, that part still belongs to humans.